Thank you so much. Well, I just want to thank TJ, Isaiah, and the entire team for organizing this important event for Halifax. I'm really delighted to be here with you all today to talk about how we can all work together to build thriving cities and really explore how cities can drive health equity and economic growth by supporting health and well-being for all. Luckily, Chris, Jane, Isabel already reinforced most of my main points, but I'll do my best to add something for you all. So just a quick overview. I'm Giselle Sebag, a trained architect, urban planner, and public health professional, and I'm committed to really improving urban health by design. I also am the first ever dedicated executive director of the International Society for Urban Health. For the past 22 years, we have been working to articulate and define the field of urban health as cities are distinct from non-urban environments, and we really see them as these complex and interconnected organisms. And there was a realization around 22 years ago when ISUH was founded that as cities were exponentially growing around the world, often without proper planning, there weren't professionals that were really dedicated to investigating and understanding how this rapid urban development and the spawning of megacities would impact our health and well-being in new ways. So the organization was founded, and we are the only global NGO dedicated to advancing our specific mission, which is to work across all of the different disciplines and sectors to address the multivariable urban determinants of health and health equity to attain a healthier future for all people in all communities worldwide. So I just wanted to start with a bit of an overview because to us, urban health is critically important, life-saving work. And I want to ask you all, I know I'm not there with you all in person, unfortunately, but I just want to ask you all to think to yourselves whether you are working in public health in some way, and just think about that as we go through the session today, because at the end of the session, if you take away only one thing, I really want to convince you all that urban health is work that you are all doing in different ways every single day through the decisions that we are making about designing and developing sustainable cities. Because if we realize it or not, we're all actually health professionals, and we are charged with either promoting improved mental, physical, and social health through your work, whether it's with local government, as an elected official or a policymaker, or as an architect, landscape architect, urban designer, engineer, real estate professional, an active placemaker, or maybe just even an active resident in your community. You're all creating the urban environments that we spend our time in. And you can either hurt our urban environments, which is unfortunately what many decisions do without meaning to necessarily, and perpetuate some of those existing systemic health inequities, or you can really improve our environments to support our health. And so for me, this is a really big responsibility, actually, but it is a choice. And I really hope that from this really important event today, all of us can think about working together to change our physical and social environments in Halifax and really be able to recognize the critically important ways that we really play in shaping health in our environments and in our cities. And hopefully we will choose to use that power for good. So I show this slide just to talk a little bit about the different determinants of health. So there are a multitude of ways that our social and physical environments make an impact on our health and well-being. I usually think about these in three main buckets. So your genetics, and those are the things that we're born with and we really can't change. So we're kind of stuck with those. But the other two are your environment, and I'm thinking about here your natural, your built, and your social environment, and our behavior, the choices that we make about diet or exercise, smoking or drinking alcohol. And the good news is, and you've heard this from some of the other speakers today, but scientists now know that the leading drivers of death and disability across the world, including in Halifax, as we heard, are non-communicable diseases. Those are things like heart disease, cancer, hypertension, diabetes. Those are really determined almost entirely by your environment and your behavior. And your research, and the research really does tell us that your environment and your behavior, they're changeable. And really only 10% or less of your health is directly determined by genetics alone. And so that means that 90% or more of those determinants in our environment are linked to changeable factors. Because thinking about it, even your behavior is highly influenced by your environment. For example, how could you choose to walk or get more physical activity if you don't have a place to walk, if you don't have a safe sidewalk? How can you choose to eat healthier food if you don't have a store nearby that is offering healthy or affordable food? So as we make these decisions that shape our environment, we really all do have this tremendous amount of influence over creating natural environments, built environments, and facilitating social connections and activities. And we have this power to create environments which make the healthy choice the easy choice. We can design safe walking or cycling paths into our cities. We can, safely engage in physical activity by creating opportunities to do so. And then, so here, I just wanted to show some of the ways that scientists have found that our environments impact individual diseases and health conditions. So when I'm talking about urban health and public health, I'm talking about upstream population health. But yes, of course, our environments also impact individual health. And so we do see really strong associations with air pollution, with noise, with excessive heat from things like heat islands, exacerbated, of course, by climate change, sedentary lifestyles, lack of sufficient green spaces, or exposure to nature, among many others. And I'll fly through, I don't have a ton of time, so I'll fly through some of these again later. And I think you've heard it from the other presenters, actually. But what we're seeing in this graphic here is that these elements impact so many different aspects of our bodies and of our health, our head, our arteries, our hearts, our reproductive systems. And it makes it more likely that we will develop these non-communicable diseases like cancers or hypertension or diabetes or cognitive impairment or dementia. For example, insufficient green space is associated with increased stress and mental health conditions, and insufficient physical activity is, of course, associated with cognitive impairment, stroke, breast, colon cancer, hypertension, and more. So these things really are important. This is from my good friend. He's a global researcher and science leader in environmental epidemiology, Mark Neuenhausen at the Barcelona Institute for Global Health. And I love to show his charts because it really shows here the ways that urban design and our urban environment influences our behavior and disease pathways, outcomes, and ultimately mortality. So you can see here, hopefully, that there's quite a powerful relationship between these factors. And of course, in terms of health inequities and equalities, differences in neighborhood environments often explain these really big differences in life expectancies across cities and zip codes. So the places that we live, work, and play affect this really wide range of health risks and outcomes. And these determinants of health do include neighborhood physical environments and housing conditions. I know housing is a huge issue in Halifax, as it is in so many cities today, occupation, education, economic stability. And I always think this is quite shocking. But did you know that the number one predictor of your life expectancy, or how long you're expected to live when you're born, the number one most important factor, more than how much money you have, more than your health insurance access, more than the types of doctors that you have, the number one most important predictor is actually where you live. So your zip code, your neighborhood, it's more important than so many other things, even genetics. And so we've seen, for example, the lack of safe access to green space, just to use that example again, it is a major health inequity. And there's articles every once in a while that pop up about this, but I remember seeing one maybe a year ago or so. There was a front page article in one of the major global newspapers that was talking about the ways that free parks and green spaces in London, for example, are one of the few great equalizing amenities in a city where so many other aspects of life they cost so much, they're so expensive, they're so inaccessible to so many, and they're truly cherished for that reason. And I know you all also had a big impact from COVID, and that was a big determining factor as well, the inequities. So here you can see what I was talking about earlier, where public health practice traditionally is focused on focuses efforts on risk behaviors, the diseases and injuries that are a consequence of these risk behaviors, and ultimately mortality. But there's this emerging public health practice that is starting to look more at our built environments, at our city policies, at our institutional and social inequalities as well. And I know these are some like public healthy charts here, but what we can see here is that really the best way for us to prevent the leading drivers of death and disability for the majority of humanity, which are people who are living in cities or urban environments, from affecting our neighborhoods is through upstream prevention. So we want to change the neighborhood environments that we're experiencing disproportionately poor health outcomes in. We want to actually improve those neighborhoods with higher numbers of people, improve the neighborhoods that really have higher numbers of people that are suffering from non-communicable diseases like diabetes or heart disease, and transform them into neighborhoods that actually support the health and well-being of residents. And it's not a mystery what these solutions are. And it isn't actually that hard to do. We know exactly what we need to do from this great research body that we have now over the last 2 decades. And these decisions that we're making about our cities make real impacts on all these health areas. Improving life expectancy for all residents can often be accomplished actually upstream at a very low cost. So the return on investment is so big compared to if we just help people feel a little bit better once they are already sick, and then we put them back into those environments that made them sick in the first place. We are losing so much opportunity there. If we go upstream and prevent those diseases and conditions from happening in the first place, we get a massive return on investment in every way. Life expectancy, quality of life, the GDP, the tax revenue that we can collect as city governments. So really, we know that that is so important. And so hopefully, as you are starting to see here, one of the key points I want to make is that the decisions that arguably make the biggest impact on health are actually coming not necessarily from medicine or from doctors or surgeons, although I know we heard from wonderful people in those fields today, and that is so important. But those are people who most of the time are treating you once you're already sick from your environments. But instead, some of these biggest, most impactful decisions about our health, most consequential, are coming from non-health actors who are creating the physical and social experiences that shape our lives. So that is in effect making all of us, everyone working to change our physical and social environment, like city planners or mayors or public servants, designers, architects, public health. We're all public health workers. That's what I want you to remember. You're all working in public health. And in fact, the leading drivers of disease and disability can actually be changed in cities by design. So I'm going to start flying through these. It's just give you a little a taste of it. Again, many of these were touched on before. But as you can see, everything with the green arrow here, it shows determinants of health that urban designers, policy planners, we can influence and we can change. And so if you focus your efforts on cities, you're really impacting the majority of humanity and you're shaping a healthier life for all your residents. And at ISUH, from an urban health perspective, we recognize that the determinants of health in cities are multivariable, and they can only be solved through close collaboration and a systems approach across all sectors and all disciplines that impact our physical and social world. So again, collaboration is so key for us. And so again, I just want to go through some really, basic areas where we know that healthy city design can really help improve health. So here we are looking at kind of a typical main street, and there's these really important everyday elements that impact our physical, mental, community health, also economic security, physical safety, civic engagement, and others. Those all make an impact on our health. And here you can see it another way. So physical activity, traffic-related injuries and death, all of which was talked about, access and exposure to nature, social capital and connection, and many, many more. They have these profound impacts on our health and well-being, and we can shape and change those. So, okay, now I'm going to do the hit list real quick for my last minutes. Incorporating physical activity into everyday life, one of the best ways to improve multiple aspects of health through design, because insufficient physical activity or sedentary behavior is one of the largest killers worldwide. You may have heard about sitting being the new smoking, and there are countless studies that have shown how physical activity is really one of the best ways to prevent chronic diseases and conditions and to strengthen the immune system. Road safety. This is another area where we can make a huge impact and where people are unnecessarily dying. Road safety and traffic accidents completely preventable. And here, well, this is a pretty terrible example. Hopefully you don't have anything like this in Halifax, but this is really typical for someone living in a suburb in the United States, also in Canadian suburbs, and really all across the world. There often are not safe crosswalks here, and people like these, a person who doesn't have a crosswalk, like this poor woman who's forced to walk across a really busy highway and risk her life every single day. People are dying because there are not policies that prioritize the small minority of people, or the policies, I'm sorry, they do prioritize the very small minority of people who drive cars over those that are too young, too old, have a disability, simply can't afford to drive to reach work or school or everyday necessities. So this is not only hugely inequitable, it is terrible for health, and I won't go into it, but it's also not good for your economic development in any way. Okay, and then food systems. So the communities where healthy foods are not accessible or affordable contribute hugely to the obesity epidemic around the world. A healthy diet might be more difficult for some people because healthy food options are simply not available, easily accessible, or affordable in your community. Now, there are also, as a bonus, we know that everything we're doing to create sustainable, healthier, more equitable cities for humans, it also helps us to mitigate climate change. And of course, heat is correctly identified as the most deadly climate change impact that we're seeing today. But early death from heat is really only the beginning. And how we create our cities, our urban environments, also really determines how well we cope with climate change. So, for example, the transportation sector accounts for 28% of greenhouse gas emissions in Canada. And healthy city design elements can slow down the effects of climate change by providing alternatives to driving cars and polluting. So we know that's really important. Now, to just touch on equity, we actually know from the research now that more equitable cities really create better health outcomes for everyone. And we can change the social capital in our communities by creating opportunities for people to meet and to connect. And we can bring people together by having work closer to schools, closer to homes, so we can really design for improving social equity and health. I think I'm just about out of time, so I'm just going to fly through these. I'm sure you've heard this, but isolation and loneliness have recently been declared public health epidemics in both the US and globally by the WHO. And one of the most effective ways for us to actually encourage social interaction and to decrease isolation and loneliness is to design spaces and places that encourage and celebrate a vibrant social life for all residents, regardless of age, gender, or socioeconomic status. And we really have some great evidence at this point about how well-connected, compact communities with attractive and fun public spaces can support social life. We know from much research and great case studies that adding some ice cream or a water element never hurts. There's really a lot of benefit, actually. It's not just fun. And we have a huge amount, actually, now almost 50 years of research and examples of this. Okay, so 5 keys to healthier cities. I've already gone through these. I'm just going to fly through them again. But mobility, really important. We have positive effects of mobility, including air pollution. Air pollution was mentioned earlier. Actually, 91% of the world's population still breathe.
Hi, Giselle. Just sorry, Ingrid needs to go and might cover some of these points too. So it's in the interest of time, wandering around wrapping up.
Yep, no problem. So we can just end right there. Basically, the power of place is really important, and place-led approaches can really help us support health and equity for everyone.